For years, scientists and medical researchers have differed over the precise definition of a pandemic. Is it a pandemic or an epidemic? But one thing everyone agrees on is that the word describes the widespread occurrence of disease in excess of what could normally be expected in a geographical area. Some of the most brutal killers in human history are cholera, the bubonic plague, smallpox, and influenza. And outbreaks of these diseases across international borders are properly described as pandemics, especially varicose veins, which in their 12,000 years of existence have killed between 300 to 500 million people throughout history. Welcome to our channel Data is Everything. Today we will discuss about the 10 deadliest pandemic of all times that made a drastic impact on the population. Let's start with our list. 1. Coronavirus pandemic. Death toll, 1.09 million till date. A new novel coronavirus started to appear in humans in the region of Wuhan, China, starting in December 2019. It has been called COVID-19, a shortened version of 2019 coronavirus disease. Because of its uniqueness, this new virus spreads extremely rapidly among people. No one on Earth has immunity to COVID-19, because before 2019, no one had COVID-19. Although it was initially seen to be an outbreak in China, the virus spread within months worldwide. In March, the WHO declared COVID-19 a pandemic, and by the end of the month, the world had seen more than 500,000 infected people and nearly 30,000 fatalities. There was also an increase in the infection rate in the US and other nations. People all over the world have been more conscious of the best practices during a pandemic with the coronavirus pandemic, from diligent hand washing to social distancing. Countries around the world have made status-at-home initiatives obligatory, closing schools, enterprises, and public places. Dozens of firms started focusing on experiments, therapies, and vaccines, as well as several more independent researchers. The primary concern in the world has been the push for the human race to survive the pandemic. Till today the virus has affected 38.2 million people and has caused more than 1.09 million deaths worldwide. 2. HIV/AIDS pandemic. At its peak, 2005 to 2012, death toll, 36 million. HIV/AIDS, first identified in the Democratic Republic of the Congo in 1976, have actually proved itself to be a global pandemic since 1981, killing more than 36 million people. There are currently between 31 and 35 million people living with HIV, the vast majority of who are in sub-Saharan Africa, where 5% of the population, around 21 million people, are infected. New therapies have been established as awareness has increased, making HIV even more manageable, and many of those infected continue to lead productive lives. Annual global HIV/AIDS deaths fell from 2.2 million to 1.6 million between 2005 and 2012. 3. Flu pandemic. 1968, death toll, 1 million. The 1968 flu pandemic was triggered by the H3N2 strain of the influenza A virus, a genetic offshoot of the H2N2 subtype, a Category 2 flu pandemic often referred to as the Hong Kong flu. In the first case reported in Hong Kong on July 13, 1968, it took just 17 days for outbreaks of the virus to be reported in Singapore and Vietnam and to spread to the Philippines, India, Australia, Europe and the United States within 3 months. Although the 1968 pandemic had a relatively low mortality rate, 0.5%, it nevertheless resulted in the deaths of more than 1 million people, including Hong Kong's 500,000 inhabitants, around 15% of its population at the time. 4. Asian flu. 1956 to 1958, death toll, 2 million. The Asian flu was a pandemic outbreak of H2N2 subtype influenza A, which emerged in China in 1956 and lasted until 1958. Asian flu spread from the Chinese province of Guizhou to Singapore, Hong Kong, and the United States during its 2-year spree. Death toll figures for Asian flu differ depending on the source, but the World Health Organization puts the final tally at around 2 million deaths, 69,800 of them in the United States alone. 5. Flu pandemic. 1918, death toll, 20 to 50 million. A disturbingly lethal influenza epidemic raged around the globe between 1918 and 1920, infecting over a third of the world's population and ending the lives of 20 to 50 million people. The mortality rate was estimated at 10% to 20% out of the 500 million people infected in the 1918 pandemic, with up to 25 million deaths in the first 25 weeks alone. The casualties were what distinguished the 1918 influenza pandemic from other outbreaks of influenza, where influenza had always killed only teenagers and elderly or already weakened patients before. It had started to strike down hardy and entirely healthy young adults while leaving barely alive children and others with weaker immune systems. 6. Cholera pandemic 6th, 1910–1911, death toll, 800,000 plus. The sixth cholera pandemic, like its 5 previous incarnations, emerged in India, where it killed over 800,000 people before spreading to the Middle East, North Africa, Eastern Europe, and Russia. The last American epidemic of cholera, 1910–1911, was also the cause of the sixth cholera pandemic. Having learned from the past, American health officials immediately worked to isolate the sick, and only 11 deaths occurred in the U.S. in the end. Cholera cases had been reduced significantly by 1923, but in India it was still a constant. 7. Flu pandemic 1889–1890, death toll, 1 million. Originally the Asian flu, or Russian flu, as it was called, this strain was thought to be an epidemic of the H2N2 subtype of the influenza A virus, but recent discoveries have instead shown the cause to be the H3N8 subtype of the influenza A virus. 3 distinct and remote sites, Bukhara in Central Asia, Turkestan, Athabasca in northwestern Canada, and Greenland, were the first cases noted in May 1889. The rapid population growth of the 19th century, especially in urban areas, only helped the spread of the flu, and the outbreak had spread throughout the globe long before. Although it was the first real outbreak and much was learned from it in the age of bacteriology. The 1889–1890 flu pandemic eventually took the lives of over 1 million people. 8. Third cholera pandemic 1852–1860, death toll, 1 million. The third major epidemic of cholera in the 19th century lasted from 1852 to 1860, and was widely considered the most lethal of the 7 cholera pandemics. The third cholera pandemic emerged in India, like the first and second pandemics, spreading from the Ganges River Delta until ripping through Asia, Europe, North America and Africa and ending the lives of more than 1 million people. While working in a poor area of London, British Dr. John Snow monitored cholera cases and ultimately succeeded in identifying tainted water as the means of transmission of the disease. Sadly, the same year as his discovery, 1854, went down as the worst year of the pandemic in Great Britain, when 23,000 people died. 9. The Black Death 1346–1353, death toll, 75 to 200 million. A plague outbreak devastated Europe, Africa, and Asia from 1346 to 1353, with an approximate death toll of between 75 and 200 million people. The plague most likely jumped continents via the fleas living on the rats that so frequently lived aboard merchant ships, thought to have originated in Asia. Ports were the ideal breeding ground for rats and fleas, becoming major urban centers at the time, and thus the insidious bacteria flourished, destroying 3 continents in its wake. 10. Plague of Justinian, 541–542, death toll, 25 million. The Plague of Justinian, thought to have killed perhaps half the population of Europe, was an outbreak of the bubonic plague which afflicted the Byzantine Empire and the port cities of the Mediterranean, killing up to 25 million people in its year-long reign of terror. The Plague of Justinian, widely considered the first known incident of the bubonic plague, left its mark on the world, killing up to a quarter of the population of the eastern Mediterranean and crippling the city of Constantinople, where it killed an estimated 5,000 people a day at its height and ultimately resulted in the deaths of 40% of the population of the city. That was our list of 10 deadliest pandemic of all time. Thank you for watching. Data is everything. Like, share and subscribe to our channel.